Well, it's been nearly 4 years since COVID-19 was declared a pandemic, and it brought out issues that healthcare workers still are dealing with today. News Press Now's Chris Fortune spoke with Mosaic Life Care health workers who recalled their experiences navigating from the unknown to fully realizing the threat they faced.
The World Health Organization declared COVID-19 a pandemic on March 11, 2020. Healthcare staff at Mosaic Life Care can still remember the uncertainty they faced at the start.
It was tense but exciting just because I don't know if anybody for sure believed we would get to where we went.
Nurse practitioner Erin Fiddler recalled a staff meeting where they were taught how to prepare for COVID.
They were teaching us how to gown up for COVID, and I thought you're right, we're never going to do any of this. And boy, did we do all of this.
Once schools began to close in the country and more residents started to seek tests at the hospital, staff became nervous about bringing patients in.
I remember nurses who did not stay in the same house as their families. They sent their families away a month or two, they saw their kids through a glass door.
As cases began to increase, nurses worked to do anything they could to help COVID patients. Fiddler recalled a 5-day stretch where she had a patient who died every single day.
It was hard. It's part of the job. It's something that you've literally signed up for being a nurse. You just never think that that's really going to happen. But yeah, I'll never forget that week. I still talk about it sometimes.
Counseling was important for nurses who went through similar ordeals.
My counselor, Lewis, was amazing, and he helped me.
Community support also helped morale. Residents showed their support for the nurses during a shift change one evening.
The community came out and was honking horns and doing lights and stuff as they came in. I can't tell you how many nurses cried that night.
But the support began to wane over time. Dallas said they lost community support when the Delta wave became the dominant variant around the summer of 2021. Patients became tired of restrictions and masks, and nurses started to become targets of that fatigue. It resulted in a disturbing trend of workplace violence.
I did not see workplace violence and attitudes from patients and families the way we see them now before COVID.
The attitude shift following the Delta wave of the pandemic is still prevalent today. In a recent press conference, Mosaic announced they had over 300 workplace incidents over the past year.
It's not just verbal, it's physical. I have patients who will try to grab, push, pull, verbally accost.
But Dallas said healthcare is heading in the right direction because of all the lessons learned from experiencing COVID.
The people who did go through it and the systems and everything are stronger from it. I very much appreciate the organization's support. The people who went through it with me will always have a special place for me, and I'd do anything for them.
Chris Fortune, News Press Now.